Hi, I'm just back from donating a pint of blood. I got my potatoes and my pen, so I'm easily pleased. There were lots of questions on the donation form about medical history and about checking the risk of infection. And that's because that blood donation needs to be as clean and as safe as possible for somebody ill and vulnerable in hospital who's going to receive the donation. There were some interesting points about cosmetic injectables. If somebody's had Botox from a registered medical practitioner, they need to wait 48 hours, but they can donate then. But if they've had any Botox injectable from a non-medical person, they have to wait at least 120 days. If somebody's had a cosmetic treatment that involves breaking the skin, like microneedling, like piercing, like a dermal filler, like polynucleotides, anything like that. Again, if it's a registered medical practitioner, you're okay after 48 hours to donate. But if that procedure was carried out by a non-medically trained person, you've got to wait 120 days. The 120 days allows for the fact that if you had an unclean or unsafe procedure and you develop something like hepatitis, by the time 120 days has passed, if you were to donate blood, that blood is going to be screened before it's given to somebody, and it's screened for all those common infections. It really just reinforces the point for me that if you're having an aesthetic medicine procedure, please see a registered medical person, because they're going to have a lot of skill and expertise in infection prevention. It's the basis of all we do. And we're going to use antiseptic, we're going to clean the skin, we'll use alcohol wipes, we'll have lots of safe procedures and policies in place. I reckon in my 35 years plus of being a doctor, as a conservative estimate, I've probably washed my hands over 300,000 times. So be as safe as you can. Seek registered medical practitioners for what are essentially medical procedures. They're going to keep you as safe as possible, as clean as possible, and prevent the risk of infection. And they'll also be able to manage any complications in the unlikely event you get one. Take care. Bye.